Hi, this is Dr. Rhonda. Grateful to be able to be here to discuss Parkinson's disease and adding prana into the naturopathic prescription pad. A little bit about myself: graduated from Sonoran University in 2007, have been in private practice ever since. The primary modalities of use are pretty eclectic: therapeutic food, optimal nutrition, botanical medicine, homeopathy, pranic healing, physical medicine, and applied kinesiology. Pranic healing has been infused into my practice for the last 10 years, with one disclosure that I'm currently teaching classes in pranic healing. For this presentation, please there's a few disclaimers that I'd like to share with you. One is that I'm by no means a specialist in neurology nor an expert in Parkinson's disease, just really excited about a few cases and wanted to share this with my colleagues. This information is not intended for anything other than educational and entertainment purposes. And should be used to help understand the disease process and educate on potential treatment outcomes. Please use intelligent evaluation, especially when coming up to the information on pranic healing. I don't expect you to believe everything. I'm just hoping that you would have an open mind for it and make your own conclusions. Please conduct your own research before deciding to recommend or prescribe any therapeutic agents discussed today. And this information is not intended to be medical advice nor substitute for medical advice. And the information is not this, all the information does not imply that therapeutics are FDA approved, safe, nor effective. Throughout the conversation that we have, I'd like to review the disease of Parkinson's disease, review the causes, the diagnosis and diagnostic criteria, discuss conventional disease management, frequently prescribed naturopathic recommendations, introduce pranic healing as a treatment consideration, display a couple of cases of improved symptoms and quality of life using combined therapeutics, and display differences in treatment considerations based off of financial concerns and cultural preferences. Why study Parkinson's disease? Parkinson's disease is number 2 neurodegenerative disease behind Alzheimer's disease. The conventional treatment is not curative at the moment. It affects over 1 million Americans and 10 million worldwide. Parkinson's disease incidence rate is expected to double by 2040. So we will be seeing this in our patient populations and probably among our communities as well. It's really expensive, and many people with Parkinson's disease are seeking complementary and alternative therapeutics. The Parkinson's disease overview, as it is a neurodegenerative disease that was first published in the United States in the essay on shaking palsy by Dr. James Parkinson's. Indian texts and Sanskrit texts from Ayurvedic practices have been described similar findings. So for those of you who are versed in those modalities, I recommend that you look up some of those texts. It's really interesting to read about. Parkinson's disease incident rate significantly increases over the age of 60 and is more common in men. Below the age of 50, it is more common that there's a genetic involvement, yet it's still a very small percentage at this time. And for the sake of the cases I'll be discussing today, I'm not going to get involved in the genetics of Parkinson's disease. The triad of symptoms are motor. Bradykinesia is a slowness of movement and speed, a tremor, resting tremor typically begins in one side of the body, and a rigidity where there is difficulty to move and engage in movement. That's why you'll see the shuffling of gait. How does Parkinson's come about? There is a degeneration of loss of the dopaminergic neurons in the substantia nigra of the basal ganglia. So this is in the midbrain, and if you remember from neuroanatomy and neuroanatomy in the midbrain, there's a butterfly shape cut that's typically made, and you can see the two darkened lines of the substantia nigra where the dopamine is nice and strong. And you can see in this presentation that is represented by that darkening or the black. So there is a loss of these dopaminergic neurons. There's also a loss of the axonal fibers of this nigrostriatal pathway, leading to the decreased loss of dopamine being sent to the striatum, resulting in the motor defects, motor symptoms. What is the cause of Parkinson's disease is not fully understood and definitely not agreed upon. There's many theories that have been considered as contributors to the loss of these neurons. I'm going to discuss a few of them, and this could be really helpful for practice, because if you know that maybe the patient that you're working with has problems with iron metabolism already, or they have a lot of inflammatory conditions, or they have more of a chronic virus, then this could help you localize what type of treatments that you may want to try first when it comes to naturopathic medicine. So apoptosis, a significant more amount, 2% of substantia nigra neurons in Parkinson's disease undergo apoptosis versus 0.5% in normal brains. So that could be one particular reason. Immunological reactions, microglial cells are present in Parkinson's disease, and the activation is associated with more loss of dopaminergic neurons. Proteolytic defects, the inability of protein breakdown can contribute to the misfolding and aggravation of proteins, and then blocking the molecular pathways, leading to cell death. So looking at protein as a particular problem. Iron metabolism, there's more intraneural iron levels that are in the substantia nigra of Parkinson's disease, an accumulation of it. Oxidative stress, inflammatory mediators are definitely present in the striatum of Parkinson's disease. Mitochondrial defects, there's a neurotoxin called MPTP, to abbreviate it, that is used as a mouse model for Parkinson's disease. It almost immediately creates Parkinson's-like effects, but they have studied to find that it does affect the mitochondrial, specifically the endoplasmic reticulum. So there can be a problem with mitochondrial dysfunction. A little bit more about the proteins. Alpha-synuclein can misfold and accumulate, leading to the loss of dopaminergic neurons. An accumulation of this alpha-synuclein protein is called Lewy bodies. So if you remember that word from pathology, it's strongly associated with the disease of Parkinson's disease. This is definitely an area where a lot of research is being targeted, because they are able to identify alpha-synuclein. So that's what they're looking to target and to decrease inside of the different areas of Parkinson's patients. And a newer type of hypothesis is a gut-first hypothesis, in that our GI system has a significant impact on our brain. We as naturopaths know this, but it's great to see that we're starting to get research with it. So constipation is being seen as a prodrome for Parkinson's disease. 50 to 80% of Parkinson's patients do have constipation. It's a really common symptom. People with constipation have high risk for developing Parkinson's disease, and as their constipation improves, the risk for Parkinson's goes down. There's a greater intestinal permeability in Parkinson's disease. GI diseases like IBD, Crohn's, ulcerative colitis have an increased risk for the disease, and alpha-synuclein has actually been identified in the GI lining and is spread through the vagus nerve into the brain. What are the symptoms of Parkinson's disease? The classic are the motor symptoms that is caused from the decrease of dopamine. We're having the bradykinesia, the resting tremor, and the rigidity. Along those come with difficult walking, decreased balance, a freezing of moving with that rigidity, slowness, and decreased amplitude of movement. Here's a great picture of a classical Parkinson's-like case with the tremors to posture, arm flexure, extra rigidity, hips and knees slightly flexed, tremor, and that short shuffling of gait. Yet we can't stop with just motor symptoms. The decrease in dopamine can have an effect on other aspects of our health and well-being. There's cognitive impairment, depression, anxiety, sleep difficulties, mood disturbances, and decreased motor learning and ability. One of the research studies that I came across said that high prevalence of anxiety, fatigue, leg pain, insomnia, urinary urgency, and nocturia. And anytime there's anxiety and stress involved, it can worsen the symptoms. How do we diagnose Parkinson's disease? It is clinically based as a diagnosis. The gold standard is considered a neuropathological exam by an expert clinician. Now, there was a diagnostic criteria set by the Movement Disorder Society in 2015 to try to help there be an easier application for non-disease specialists to be able to diagnose Parkinson's disease. The interesting thing about this criteria is that it's also meant to detect small changes in non-motor symptoms and to integrate that into the criteria. And the thing that they're looking for with this diagnostic criteria in the future is to try to determine early onset of Parkinson's disease. More about this disease rating scale. It is not as simple as it seems. If you love neurology and you feel great about doing a good neurological exam, you can look up the scale. It is available, yet permission is required for use. It does need to have the presence of Parkinsonism, bradykinesia, and only one of the following, rigidity or tremor, to be able to meet the diagnosis of Parkinsonism. Then it moves on to 3 additional steps to solidify the diagnosis. The first one is that there's no absolute exclusion criteria. An example of that would be if the symptoms are located to the lower extremities for more than 3 years, you need to start looking at other differentials. There are definitely a lot of motor-like symptoms with other disease processes. So then it needs to have the supportive criteria, because if there's a loss of dopamine and they benefit from dopaminergic therapy, that's going to assist in the supportive criteria. No red flags can be met. Examples of those, and these are just some of the examples that are on this criteria list, but no red flags example would be if it's a quick onset of gait impairments or autonomic dysfunction, that's going to disqualify the diagnosis of Parkinson's disease. Aside from clinical diagnosis, there's other tools being used. The DAT scan is going to inject a drug into the blood that attaches to the dopamine transport system, passes the blood-brain barrier. So a scan can detect the presence of this around the striatum. However, evidence shows that this clinical diagnostic criteria and the DAT scan are pretty accurate in similarity and accuracy. Other tools can be used, MRIs, olfactory testing, but really those are meant to help rule out differentials more so than confirm the diagnosis of Parkinson's disease. Other emerging diagnostic tools that seem to be really helpful for Parkinson's disease, yet not quite released or mainstream: PCR testing for damaged mitochondria, genetic testing, and even a skin biopsy is coming out. It's not quite ready for clinical use, but it's identifying an accumulation of alpha-synuclein protein that's found inside of the skin. The stages progression of the disease process has been staged since 1967 by Hohan and Yar, and it's based off of the clinical disability. Stages 1 through 3, your patients are going to be able to move, function on their own. 4 through 5, they're going to be having needing assistance. So 1, it's the symptoms are really not quite interfering with their daily activities. 2, the symptoms have spread bilaterally. 3, they may be falling a little bit and starting to need assistance. 4, they could be walking with a cane or a walker. And 5, they're going to need assistance with a wheelchair. Overall, the average life expectancy of Parkinson's disease is reduced. If your patients are diagnosed after the age of 65, the typical disease death rate is only reduced by about 3 years. So they still can live. Parkinson's patients that are diagnosed as elders really can still live a great long life. Yet those that are diagnosed under the age of 30 have less, on average, 11 years less of a lifespan. Pharmacological treatment. Pharmacological management is not classified as disease modifying or neuroprotective. We're looking at symptom management currently. Dopaminergic therapy is the suggested as initial therapy. It's the most effective as of right now for symptomatic relief. What is started with is an initial therapy of a small dosage, slowly titrated up by a half a tablet to reach a therapeutic range. There are dopamine agonists that are also used, and monoamine oxidase type B inhibitors that are going to prevent the degradation of dopamine. There could be some neuroprotective effect with these type of treatments because they're reducing free radical release. However, still not seen as the drug of choice for initial therapy because it doesn't affect symptoms as well. A positive response to dopaminergic therapy is part of that supportive criteria for diagnosis. Oftentimes, as naturopathic doctors, we'll have patients coming to us because they don't want drug therapy, yet a neurologist could be recommending it because they want to make sure that this is the proper diagnosis. They could also determine the initiation of drug therapy because of the effect of the disease on the dominant hand, the degree the disease interferes with the daily activities or quality of life, if there's severe bradykinesia, disturbances of gait causing falls, and also the patient values and preferences regarding the medications can have an effect on if prescriptions are going to be made or when drug therapy is going to be initiated. One of the complications of dopamine therapy is a dyskinesia, which is very common as a result of, and over 50% of patients within 5 to 10 years of initiating levodopa therapy will end up having these dyskinesias. It also can happen in those that are overprescribed dopamine therapy. So you'll see involuntary movements. Motor fluctuations is most likely due to the excess use of drug or that loss of the dopamine terminals. So no matter how much dopamine you give them, it's not going to be able to have an effect and therefore cause the dyskinesias. Other medical intervention is stem cell therapy is starting to get introduced. All right, naturopathic support. Hopefully these philosophical words look familiar to you. I don't have them up here for anything other than a guide to help you see a little bit into where the treatments that I used were, how they're organized, and to categorize, making sure that I got every bit of the naturopathic philosophy involved in my treatment plan. So we're looking to improve the naturopathic healing capacity, identify the most insulting causes to the progression of disease and its process, use the least invasive medicine as possible, support the whole person, have constant education for enhanced compliance, and delay the onset or reduce progression of the disease. Naturopathic support, the vis medicatrix naturae. We all have our favorite ways of supporting the vis. Some of us are trained in Chinese medicine, others classically trained in Ayurvedic medicine. I've really enjoyed using classical homeopathy in my practice, so you'll frequently see a homeopathic remedy added, a classically prescribed homeopathic added to the support plan. It's inexpensive, why not try? Mushrooms, I love mushrooms. Mushrooms, the research is really just emerging for neurite outgrowth and neuronal regeneration using mushrooms. Most of the research is using lion's mane and others. However, I was unable to find any research of mushroom use specifically for Parkinson's disease, and look forward to the potential of that in the future. That's why I put a question mark there, because if we're having a brain disease, why not support the brain? We just don't know specifically how it's going to support this disease process. Pranic healing helps me support my patients with improving vitality. Pranic healing is a non-touch healing modality. It's really a newer modality. It was originated out of the Philippines in the 1980s by a man named Master Choa Koksui. I came across pranic healing in multiple different ways, but when cavernous malformation in the motor cortex of the left hemisphere of my brain stopped hemorrhaging by the use of pranic healing, I really wanted to see all the power that it could potentially have, and have had the privilege of working with some severe degenerative cases using pranic healing. Pranic healing is based off of laws. There's laws and there's principles. It's really a system of healing that is used to help regenerate and restore vitality, improving the natural healing capacity in our patients, which sounds familiar, right? The two laws are the law of self-recovery and the law of life force. The law of life force parallels the vis medicatrix naturae in that we have something that flows through us that allows our body to be able to regenerate, recover, and heal. The modality focuses on the energy anatomy. Just like we have a physical anatomy, we do have an energy anatomy. So the energy anatomy is highly discussed, and the energy anatomy feeds fresh prana to the physical anatomy as material to perform a catalytic type of reaction, accelerating the healing process. So let's say I have a paper cut, small paper cut, no need for Neosporin or a Band-Aid. We know this, we're naturopathic doctors. The majority of people do know this. We just don't know why we trust it. And it's just the way that it is. So in pranic healing, we're taught that fresh prana or life force or the vis medicatrix naturae, there's different terms for these words in different cultures, is there to help act as a catalytic reaction for healing. The old stagnant prana is then harboring around after the cut. And so what we're doing in pranic healing is we're cleaning it out. We're wiping away the old stagnant prana, applying fresh to continue that catalytic reaction, allowing for an acceleration of healing. And if applied regularly and frequently, then a paper cut, which I've seen with my own two eyes, can heal in a matter of 20 to 30 minutes. There's also a specialized technique called pranic psychotherapy, and this is great for psychological concerns. In Parkinson's disease, there's the mood disturbances. There's the fact that they know that they've been diagnosed with this disease that there's no cure for. So they sometimes have, fear and doubt and worry, and pranic psychotherapy can easily go in and help remove some of those energies that are blocking the fresh prana from flowing through our system. Pranic healing acts to improve prana and vitality. If it's applied properly, it can take place at an accelerated pace. And the application really needs to be above the rate of deterioration for optimal results. I think that's one of the things that is commonly misunderstood, and we think, oh, we can undergo this thing 1 or 2 times and expect some great results. We need to understand and be very in trust that the healing needs to continue in order for sufficient results. Pranic healing, as I said earlier, is like a recipe. It's like a cookbook. There's a system, there are laws, and there's principles. So you're taught how to open up a book and follow that recipe or follow that protocol. Anyone can learn how to apply it. And so let's take it into consideration what we're talking about, Parkinson's disease. What would happen in a pranic healing session is that we would clean and energize the energy center at the base of the spine. That energy center controls and regulates the bones and muscles and blood. So if you clean that, those areas can be sent fresh prana to be able to regenerate. They have a better regeneration in those areas. In that protocol, you're going to clean the spine, which is where our nervous system flows through, clean and energize the energy centers that supply our GI organs. So that would go along with the gut first hypothesis, making sure that we're assimilating food properly. And then it's going to clean and energize the energy centers around the head, making sure that there's fresh prana that's being sent into these areas, ready for proper healing. There's other energetic techniques in pranic healing that can easily help cleanse and energize this energy anatomy. Specifically, Super Brain Yoga. It's a 10-minute technique. Anyone can learn how to do it. It's going to clean our energy anatomy and send fresh prana up to the brain quickly. Meditation on Twin Hearts is a loving, kind, guided meditation that has been shown to reduce peace and increase gamma and alpha brain waves. Pranic breathing is a quick and easy breathing technique that I've seen reduce blood pressure up to 20 points at a time in my office. Moving back to naturopathic support and treating the cause. So we improved the vitality of our patients. Now we're going to treat the cause. And just going through the specifics of all of the different potentials for the causes. One is that we're going to enhance dopamine. It's well known that reward-based responses can improve dopamine levels. So think about how you can act with your patients in a reward-like way. It can be a fun game. It can be certain goals that are encouraging them to take care of themselves better, follow your plan, so on and so forth. Protein intake, L-tyrosine can convert to dopamine, so make sure that they have nice protein inside of their treatment plan. Mucuna, we all know about mucuna, but the research is really amazing with mucuna. It naturally contains L-dopa, and there has been studies that show that it has a faster onset to the effects of pharmaceutical L-dopa. It doesn't, as of right now, it's not shown to be better, but it's great that there are potentials for there having a faster onset, and there's other benefits that you'll see shortly about mucuna. Fava beans naturally contain L-dopa. They're easy to get a hold of. You can find them at the grocery store, Indian grocery stores. It's a very common food in South America, so enjoy some fava beans. Withania, just a small amount, increases the level of dopamine, may also be helpful for the Parkinson's patients that are struggling with insomnia. Treating the cause of reactive oxidative species, the Mediterranean DASH diet has been shown, I mean, it's rich in fruits and vegetables, so of course it's going to reduce oxidative species. I think, you know, as you read this, you're going to come up with your own favorites in your mind to reduce oxidative stress. I'm just going to review the ones that seem to have research behind them on specifically with Parkinson's disease. So this Mediterranean diet decreased depression in patients and decreased excessive daytime sleeping, decreased constipation, and showed longer longevity after diagnosis. Mucuna inhibited those reactive oxidative species and improved glutathione levels in the brain. Scutellaria had an anti-inflammatory effect. Withania decreased neuroinflammation. Goji berry slowed the accumulation of reactive oxidative species and nitric oxide levels. Curcuma decreased reactive oxidative species accumulation. Ginkgo may prevent dopamine depletion and oxidative stress. Resveratrol decreased reactive oxidative species. And walnut, this was really fun to read. A small amount reduced oxidative stress and resulted in increase in dopamine levels. This protein misfolding problem, safflower seemed to help, where it suppressed alpha-synuclein overexpression. Curcumin reduced alpha-synuclein toxicity. Resveratrol activated the breakdown of it and decreased the aggravation. Scutellaria inhibited the aggravation, and goji berries inhibited abnormal aggravation of alpha-synuclein. Immunological reaction, there's a Chinese herb. I'm not familiar with the Chinese herbs, but there were about 6 different classic or like constitutional type of Chinese formulas for Parkinson's disease that I came across. But this herb specifically had a tremendous impact if there was an immunological problem, with decreasing terminal necrosis alpha and interferon gamma. Resveratrol is also going to decrease as immunological markers and decrease astroglial activation in the brain. Mitochondrial dysfunction. Mucuna restored damaged mitochondria. Resveratrol increased the rebuilding of mitochondria. Curcumin inhibited the breakdown of mitochondria, and Scutellaria increased normal breakdown of mitochondria. Cells undergoing apoptosis. Mucuna again inhibited this toxin, this neurotoxin's activation of NF-kappa beta. Goji berries decrease the percentage of apoptosis, and curcumin did as well. If we're looking to try to improve iron metabolism, ginkgo regulated the iron metabolism. Mucuna helps sequester the activity of iron. And then improving GI integrity, absorption, and assimilation. I didn't go into this. This could be its own talk in and of itself. I think we've all had plenty of lectures and have determined our favorites when it comes to healing the gut. It's our area of specialty. So if you do come across a patient with Parkinsonism, just really don't forget to work on the gut. First, do no harm. Parkinson patients can last a long time with a great quality of life. So take into consideration their preferences, their financial considerations, and their cultural norms. They're looking for a teammate, someone to develop a relationship with. And I don't know about you in your practice, but sometimes when elders come in, they are just starving for social interaction. It's almost like the only time that they get out is for their doctor's visits. So think about how you can create a relationship with them, because 21% more symptoms of Parkinson's disease were reported in patients who have few or no friends. Parkinson's patients identified as lonely had 55% increase in their Parkinson's symptom severity score. Treat the whole person. Sleep, of course, sleep is so important. Movement, so important. Sleep melatonin in varying dosages has shown to be important for Parkinson's disease or quality of sleep, yet only 5 milligrams in one study improved sleep disturbances, sleep quality, and daytime sleepiness. This is it's always up for debate how many milligrams of melatonin. So know that there could be a varying amount in Parkinson's to create therapeutic benefit. Improvement with exercise, high intensity interval training, 80 to 85% maximum heart rate, 4 days a week for improved the motor and non-motor symptoms. Yoga improved the disease rating scales. Dance improved motor function and functional mobility, specifically the tango and the waltz foxtrot for balance and gait. There was, I think it was the Irish set dance that improved happiness, but it didn't really seem to affect gait or any of the motor symptoms associated with Parkinson's disease. So when you're like, oh, you need to move, then be a little bit more specific about what type of movement to be able to gauge results. Doctor is teacher. Professional rehab. One of the things that we want to do is focus on learning, motivation, and reward. We want to get that dopamine nice and strong, motivate them to try to get motivation nice and strong, and constantly educate on why you're doing what you're doing. Prevention, the Mediterranean diet again may reduce the occurrence of those non-motor and motor symptoms. Speech therapy, one of the things you may want to think about earlier than later is Parkinson's can definitely affect the muscles of speech. So you want to get them involved in some speech therapy that's focused on improving speech volume, or a Parkinson's like specific therapist. Exercise has been shown to decrease the progression of motor and non-motor symptoms. So we're trying to prevent any further delay in their motor activity. Boxing reduced the number of falls. Tai Chi, less falls. And the interesting thing is that Tai Chi 2 times a week was superior to resistance training and stretching for postural stability. So think about that in your elders. It's pretty easy to be able to get some community Tai Chi classes these days. Now I'd like to move into my cases. This patient I'll call O. He was diagnosed at the age of 70, and I've been working with him since June 2021. He presented with Parkinson's disease, initially taking carbidopa levodopa at a pretty standard dosage. His comorbidities include as recovering alcohol dependency, type 2 diabetes, and difficulty maintaining weight. His Parkinson's related symptoms are right arm resting tremor, stiff, rigid gait, that constipation. He also struggles with low normal blood pressure with an average of 90/60, lack of mental clarity, mood changes, and has a little bit of the dementia where he starts seeing cats, or he frequently sees cats in his apartment, and he has no cat, and vertigo. One of the most bothersome concerns overall is that he's constipated and he hates taking pills. And he does not like taking pills. His budget is limited, and he's a Native tribal member, so thinking about things that could help him with his treatment plan to make sure that we are watching out for his overall concerns. In order to enhance vitality, we use Pranic healing as Parkinson's disease protocol applied at most of the visits for about 20 to 40 minutes. We'll check in on his medicine, see if there's any new or bothersome symptoms, how his conventional medicine is going, and then spend the rest of the time doing a Pranic healing session. We've prescribed a lot of classical homeopathy, mostly Nux vomica, Ignatia, and Nature moraticum. To treat the cause, we've worked to reduce free radical damage, mostly with the insulin resistance type diet, going back to cultural tradition of nopalitos that are very helpful for blood sugar, fiber, acting as a demulcent for his GI system. We've been using botanicals to optimize his blood sugar metabolism. And then we're optimizing dopamine production using fava beans. His wife is a fantastic caregiver. She'll add fava beans into the cooking. And we create a lot of motivational goals. His being underweight can affect his mood and his kind of sense of power. So we're looking to try to help with different ways to improve his weight gain. We'll do protein powder for that L-tyrosine intake and weight gain. To do no harm, we just add little bits of naturopathic pills, and we try to keep financial burden to a minimum when it comes to particular foods and therapeutic foods even. To support the whole person, mood support, he'll come in being grumpy about having to take pills. He'll come in and be grumpy about not being as strong or as heavy as he used to be, and we'll do pranic healing, change the classical homeopathy, and he's on his way. Constipation, we've just done a little bit, senna tea, magnesium glycinate, and prunes. And then the vertigo, we've been working with adrenal formulas. Educate, we constantly have to revisit the value of why he's taking the medicine, why he comes into the naturopathic sessions, the goals that we have, the goals that we want to set for the next Christmas, for the next kid's graduation, and then we'll have contests about weight gain contests. And to prevent, he walks with his wife regularly. He lifts weights in his chair. He's undergone therapy. He'll do super brain yoga daily, and weight goals. Throughout care, in spite of COVID-19, asymptomatic pneumonia, he said bladder infection, prostate surgery, falls, and lack of desire for medical management, he's obtained improvement in weight, hemoglobin A1C improved, maintained adequate sleep and energy, abstained from alcohol, stable mood, remains at home in the care of his wife and his family, and continues to take his prescribed medicine, which is a win. We've only had to increase, or his levodopa, carbidopa has only increased just a little bit recently due to a little bit more shuffling gait and a couple more falls. But overall, he believes he's 50% better due to the overall naturopathic care, and states that he can feel improvements directly after the visits with the pranic healing sessions. Oftentimes, his tremor will stop during the sessions, and he'll leave feeling great. Case 2, I'll call L. He was diagnosed with Parkinson's disease, age 72, was put on carbidopa levodopa to confirm the diagnosis and comorbidities of anxiety. He had trust in Pranic healing. We've used it previously for PTSD and hypertension. He was also able to make the financial to Pranic healing sessions. Recently retired, was so excited to be able to spend more time on his boat and with his grandkids, and then this came about. So he had a family member that suffered severely with Parkinson's disease, didn't want that to be his story, so he said, yes, let's do Pranic healing. We did it according to the suggestion of the protocol, where you're doing it frequently for the first week, regularly for following up to 6 for continuously. We did about 18 sessions over 6 weeks, and also prescribed classical homeopathy, arsenicum album. To treat the cause, we reduced oxidative damage with green tea, quercetin, optimized dopamine with mucuna, supported the whole person with insulin-resistant type diet, reduced anxiety just a little bit with lavender, and educated by valuing the stress modification, just really emphasizing stress modification, knowing that anxiety was in his health history and anxiety over disease. Prevention, he's undergone occupational therapy and does meditation on Twin Hearts daily. He actually calls it Pranic healing, panic healing, and because he sees such a significant impact on his mood. Patient reported after those 6 weeks, 85% symptom improvement overall. The area that we didn't quite get we got significant results because he was able to start playing the piano again, but not as hopeful of results with the resting tremor, but it didn't seem to affect his quality of life or ability to play the piano. His shuffling gait resolved. He was able to start initiating Parkinson's boxing, which he really loves and does a lot. Still does meditation on Twin Hearts. Just heard from him last month after about a year. He said overall he's holding still 80 to 85%, but he's starting to see maybe a little bit delay in playing the piano. His blood pressure rose in one reading. He noticed a difference in his speech. So he's thinking about undergoing more Pranic healing to address the symptoms before they become a problem. In summary, Parkinson's disease is a neurodegenerative disease affecting dopamine production. The symptoms are motor and non-motor. The diagnosis is clinically based. Many potential causes, compounding factors, and symptoms. It can be slow progressing, so please develop a relationship with your patients that they can trust to help walk through the varying symptoms that they may be struggling with. And the medical therapy is currently symptom management only. Naturopathic goals and summary is that potential naturopathic support options, there are a lot for prevention, treatment, to delay the disease process, to manage the motor and non-motor symptoms. The modalities and treatments may change based off of the individualized aspects of the cases and the stages of the disease, as you saw in the cases that I displayed. The modality goals are to improve vitality, reduce obstacles to cure, support damaged system, and keep motivation strong. Downfalls of some naturopathic therapeutics is that the studies are limited. They're mostly mouse studies. Human dosages are really unknown, and we don't know about the combination of multiple therapeutics combined. Pranic healing is a potential addition of naturopathic treatment to enhance vitality for the acceleration of healing and or the reduction of the side effects. Possible solutions is a possible solution for patients that don't like to take pills, they aren't compliant, or later stages of the dementia, they can't remember to take their medicine. So maybe this could be a potential non-invasive application for those ones. Patients, loved ones, our office staff, ourselves, we can easily learn and apply this in person, via distance. The downfalls to the therapy is that it's really difficult to conduct studies. There's many variables involved. Measuring tools are limited. And client receptivity is very important when it comes to pranic healing. So there has to be a lot of education about what the modality is. If I were to put together a general treatment plan, it would definitely include a Mediterranean type diet, including safflower oil, fava beans, goji berries, dark berries, peanuts, walnuts. Exercise would either be high intensity interval training or dancing 4 times a week, really honing in on relationships, conducting super brain yoga daily, and doing pranic healing sessions 3 or more times a week. The starting lineup for herbs would include mucuna, scutellaria, resveratrol, curcuma, withania, for all of the reasons displayed earlier. I want to thank you for this opportunity. Our profession has great potential to support Parkinson's disease in all different stages. May this information help you feel more confident engaging with Parkinson's disease. I think I'm ready for questions.